We now discuss about location methods and tune measurements. One of the basic prerequisites for any successful acupuncture treatment, besides a differential Chinese medicine diagnosis and the relevant point selection, is the correct point location. There are various methods for locating acupuncture points. So first we have here the anatomical approach. Many acupuncture points are situated at the clearly defined anatomical locations. For example, in depressions, at muscles and tendon insertions, in grooves, at joint clefts, at bony prominences, etc. With some experience, the palpating finger will often automatically fall into the right depression and holes. Various anatomical structures and zones form the basis for point location. Second approach is using the fixed markers. Fixed markers are not affected by body position or by movement. These include bony landmarks such as depressions or prominences of the skeletal system, but also the finger and toenails, the nipples, the umbilicus, etc. Most of the proportional tune measurements rely on fixed markers. Third approach, using the movable markers. Movable markers often become more clearly defined with a particular body posture or movement. For example, by flexing the elbow, the cubital crease becomes much more clearly visible to locate LI11 precisely. Equally, the most distal palmar crease becomes much more visible when making a loose fist in order to locate SI3. One other parameter that might determine the location of a point include change skin consistency, sensitivity to pressure, puffiness, or a resistant sensation when palpating gently with a finger. Fourth method or fourth approach, using proportional measurements. When trying to locate points not situated at any prominent structure, Chinese medicine applies the proportional tune measurements. Fifth approach, using electric tools. These measure the electric resistance of the skin in order to find the correct location of the points. Generally, electric resistance is lower in the immediate area around the point. This method is specially used in auricular acupuncture, but it has not proved to be a practical method for body acupuncture. The sixth approach, using the very point technique as described by Dr. Gleditsch in 2005. The needle is held loosely and guided in a dancing fashion over the skin. When the correct point, the very point, is found, the needle will catch onto it and penetrate the skin as if out of its own volition. Now let's talk about tune measurements of the body. In Chinese medicine, the distances on the body are traditionally measured in tune. In contrast to the official Chinese tune, which is 1 tune equal to 2.5 centimeters, the tune used in medical context is a proportional unit of measurement that takes the individual proportion of each body into account. This relative unit of measurement is defined by either using the width of a particular finger or fingers, which is the finger tune, or by the distances between clearly defined landmarks of the body, or the body tune. In clinical practice, many points can be located by using finger tune measurements. It is important, however, to use the patient's fingers, not the practitioner's fingers, for reference. If the fingers of both the practitioner and the patient have approximately the same width, the width of the practitioner's fingers can be applied for point location. Otherwise, measurements have to be adapted to correct minor deviations, for example, by adjusting the spaces, if it's narrow or wide, between the practitioner's fingers when using finger tune measurement. Here we have a table on how to use the finger tune measurement. So one, tune as thumb measure. It is the width of the interphalangeal joint of the thumb as its widest point. To tune as index finger measure, this is the distance of the two distal phalanges of the index finger. One, tune as middle finger measure. With the tip of the middle finger placed on the thumb, the distance between the ends of the creases of the interphalangeal joints of the middle finger. 1.5 tune as two-finger measure. This is the width of the index finger and the middle finger when placed closely together at the level of the distal interphalangeal joints. With two tune as index, middle, and ring finger measure. This is the width of the index, middle, and ring finger when placed closely together at the level of the distal interphalangeal joints. 3 tune as four-finger measure. This is the width of the four fingers when placed closely together at the level of the distal interphalangeal joints. This is also equivalent to the one-hand breadth. Second approach is the body or proportional tune, which is based on the proportions of particular sections of the body, which are divided into specific number of units. In clinical practice, the measure of these divisions can be quite cumbersome. Therefore, the spreading hands technique is commonly applied. It allows the practitioner to quickly determine the midpoint of a given distance, and combined with finger tune measurement and palpation, is in most cases sufficient for correctly locating a point. For point location on the abdomen, a prepared elastic tape can be used for measuring proportional tune.